Okay, so let us start with our discussion on the topic of distribution. So previously we talked about absorption in really great details. In distribution, there are certain factors which affect distribution. Number one being lipid solubility. Number two being pH or ionization. Number three is plasma protein binding. And all these three we have discussed in absorption and we know the concept well. The same concept implies in distribution as well for three of them. As we discussed in plasma protein binding, that the free drug, when it is available, it gets bound to the plasma protein and is then carried along with blood to various destinations. And lipid solubility, we know that since each and every biological membrane is made up of lipid, so obviously a drug needs to be lipid soluble to pass through it, and it should be lipophobic if it needs to travel in the blood. Post that, we have affinity. The affinity of the drug to the plasma protein needs to be there, and then blood flow. Obviously, whichever organ would be having highest amount of blood flow, the drug would be more in concentration in that particular organ. Now post that, we need to discuss the concept of volume of distribution. It's a very important concept, must be known. Now volume of distribution, or VD, is defined as dose administered upon the plasma concentration of the drug. Dose administered upon the plasma concentration of drug. So let me give you an illustration so that you remember it quite well. This is the drug, and here we have, let's say, this is the blood or the plasma, you can say. So dose administered upon the plasma concentration of the drug. Now if volume of distribution is high, that would mean that more drug is in the tissue and less is in plasma. Obviously, as we can see in the equation, VD is inversely proportional to plasma concentration. So when VD will be high, plasma concentration will definitely be low. Let us consider these two things. Let us say we have drug A and drug B in the oral route, and we administer them in oral route. A is having high VD and B is having a lower VD. A with high VD, which would mean that plasma concentration would be low, and to generate the therapeutic effect, we would have to give greater amount of dose of drug A as compared to drug B. Now this particular concept of more dose, which is to be administered in case of a drug having higher VD, this is known as the concept of loading dose. Here we are talking about the oral route. Keep this in mind. So a drug which is having a higher VD or volume of distribution would be requiring a loading dose so that adequate amounts of plasma concentration is achieved so as to achieve the necessary therapeutic effect. Post this loading dose, we carry out a maintenance dose for establishing and maintaining the therapeutic effect. So we would say that there's an MCQ which comes saying that what is the main determinant of loading dose of a drug. So VD is the main determinant. And for all of my friends going to gyms, they would have known this term known as creatinine. It is used for bulking up in bodybuilding. So this particular drug has a very high VD. So we need to give a loading dose. So here we prefer a loading dose of 15 to 20 mg for a week, and post that we go for a maintenance dose, and this helps us in achieving adequate results and larger muscle mass in case of creatinine administration. Other example includes chloroquine, which is very much popular by the name of hydroxychloroquine in the current scenario. So HCQ has the highest VD. A drug which is having the highest VD is chloroquine. It has a VD of 1300 liter per kg. So a large loading dose is required here. So what happens is that it has a very high chances of toxicity. This drug can very easily get toxic owing to its high loading dose, and if this toxicity occurs, it cannot be reversed by hemodialysis. Hemodialysis is a technique by which we kind of remove excess of the drug if toxicity occurs, but here we won't be able to do that. Therefore, HCQ is not prescribed to be taken by the general population. It is only for healthcare workers who can understand when the drug has reached its adequate concentrations. Post that, the other examples include digoxin, propranolol. There is also morphine as one of the examples, and etc. So post discussing the concepts of distribution, we can move on to the concept of metabolism. Let me clear out my board before starting with metabolism.